It is unconscionable for a program that provides support for 24 million Americans to be abandoned, supposedly for a resolution that's going to continue funding for the government. Hi, this is Congressman Joe Courtney. I'm speaking to you from my office in the Rayburn Building in Washington, D.C. In the next few hours or so, there's going to be a vote in the House of Representatives to pass what is called a continuing resolution to keep government programs funded at a level pace while the full budget for this coming year will be actually finalized. The problem with this vote today is that it really does not continue existing services and programs, which by its name should be the result and the outcome of bringing a bill like this to the floor. A number of items are not being continued. The biggest and most objectionable is the program that's been in place for 4 years to provide tax credits for people buying their health insurance on the Affordable Care Act exchange. In Connecticut, it's called Access Health. Over the last 2 months, with town halls that I've held in person, town halls that I held by telephone with 10,000 people, we have heard from people from one corner of Eastern Connecticut to another describing what is going to happen to their health insurance in 2026 if we do not continue the support for this program. Christine from Coventry described her premiums going up from $800 a month to $2,400 a month. Recently, I met with a couple from the town of Enfield who brought in their premium notices. Incredibly, their premium for their health coverage, which this year was $295 a month with deductibles and co-payments, is going up to $2,449 a month. And that's with a high deductible plan with other co-payments and out-of-pockets. And again, this has been repeated over the last few weeks all across the district, whether it's folks up in the quiet corner, whether it's people along the shoreline in the midsection of the 2nd Congressional District. It is unconscionable for a program that provides support for 24 million Americans to be abandoned, supposedly for a resolution that's going to continue funding for the government. Secondly, as someone who works on Navy budgets, over really the last 6 years, we have continued production for the Columbia-class submarine in continuing resolutions with special funding to make sure that the hiring of workers, the purchase of materials is not going to be interrupted by, again, having budgets late for delivery. The Navy sent over a request for fully funding this year's plan for Columbia, and for reasons that, again, have not been stated at all by the leadership in the Senate. They basically rejected the Navy's request. There is zero funding for the Columbia-class program included in this bill that we are voting on. And again, that is different from bills that we've taken up going back to 2020 and 2019, whether it was Democratic speakers or Republican speakers or control of the Senate by either party. This is going to cause real disruption to a lot of the hiring and work that's going on down at Electric Boat in southeastern Connecticut. The Navy, again, expected this request to be agreed to. And again, it is completely absent from the bill that we're voting on. And again, I learned of this Saturday night when the text of the bill was finally released, and am doing everything I can to make sure that these jobs are going to be protected and not impacted in a harmful way because of sloppy and careless legislating that came out of the Senate. Again, if people have questions about my comments here or any other questions regarding the CR, please do not hesitate to contact my office. These are difficult situations because we obviously want to get the government fully functioning again, but leaving out 24 million Americans who are going to, in many cases, lose their health insurance and shortchanging a program that's so important to our national defense in the economy of Eastern Connecticut has failed the test of what the people of Eastern Connecticut really need. We should reject this budget bill, and we should go back and make the changes that actually can be done quite easily, and finish the job the right way before it gets sent to the president. Thank you for listening.